So,
Great, thank you. And Darin, I appreciate your patience. I'm coming to you, and I expect a good Voltaire quote. So,
That might
um,
be the only one I got.
all right. So for people battling Lyme disease, how effective are each of these approaches? And I got a number of approaches. I won't hit you with all of them right away, but I'll give you a couple of them, and then I'll give you a few more. Um, Antibiotics, ozone therapy, and hyperbaric oxygen chambers.
Well, again, I think when you think about Lyme disease, we think about the total person, they're all doing different things to the body. And there's a lot of therapies out there in the Lyme world that can be effective. And again, it varies from person to person. I think if we're talking about antimicrobial therapy specifically, I mean, antibiotics, particularly if it's acute Lyme disease, can be extremely effective. For late chronic Lyme disease, the research is not terribly compelling for using long-term antibiotics. And the research suggests either people get temporary benefit or they get no benefit at all. And I've seen people clinically that have been on antibiotics, and some people do well. I see a lot more people that end up having to stop because the side effects were worse than the disease. Ozone therapy, we do ozone in our practice. Again, it can be effective at some places. Again, it's better for acute Lyme disease. I don't think it's terribly beneficial for chronic Lyme disease, and it's very expensive. Hyperbaric oxygen, I'm a huge fan of. It can help mitigate a lot of the symptoms of Lyme disease. It's a good anti-inflammatory, it can help with circulation, can help release stem cells from your bone marrow. But as a direct antimicrobial therapy, even at high pressure, you're probably not going to get much of effect in that way. So it's a great adjunct therapy and everything else you're doing, but I wouldn't use that as a standalone antimicrobial therapy.
Thank you. Okay, next round. IV colloidal silver, stem cells, and water fasts. Oh, I meant that's for you. I'm adding.
Yeah,
I'm adding to the list. I don't want. I have a whole list. I have one more round of things, and I
yeah,
didn't want to give you all of
sure.
them at one time. So
So IV colloidal silver. I personally use a lot of silver. As it's great as a nasal spray, great for throat infections. I've not personally used it IV for specifically Lyme disease. I know a doctor in Florida who used it very successfully. So again, it's just that the amount you have to use, the timing. I think it gets to be quite expensive for most people to do that, but it's reasonable. So what was after IV silver?
stem cells was the next one.
Yeah, I mean, stem cells isn't a cure for Lyme disease. I think stem cells have a lot of potential in a lot of different areas. The problem with stem cells, particularly if you're doing it IV, we don't know where the stem cells are going to go. We don't know how often you need the treatment. We don't know what stem cells are going to be the best type of cells. Should you be using exosomes, mesenchymal stem cells? The research is still being done. So again, for what people end up spending on it, which ends up being thousands and thousands of dollars, I think there are a lot more cost-effective ways to approach Lyme. And I'm sorry, after stem cells.
Water fasts.
Yeah, I mean, water fasting is great. Most cultures around the world do fasting routinely. Again, it induces something called autophagy, which is your body's innate ability to start cleaning up all the old, dead, dying cells. So I think, anyone out there, despite their health status, can do at least a 24-hour water fast. If you can get up to doing even a 2 or 3 day water fast, that can be incredibly helpful. There's really very little risk. There's very few conditions where water fasting is contraindicated. Other than that, most people feel kind of grumpy for a few days and not eating, but we as humans can survive without eating for 3 days, and most people have enough body fat on them that they'll be just fine. But again, what it does metabolically, can be huge. And there's a company out there called Prolon that developed kind of an eating pattern that mimics fasting. It's a 5-day program, and the whole idea, this is Walter Longo's whole thing, is to try and induce this autophagy, and again, it'd be really, really helpful for someone dealing with chronic Lyme.
Okay, and then I got two more: herbs and nutritional supplements.
Well, I'm going to be biased in this because I'm a naturopathic doctor. I think herbs work incredibly well. Again, I treated over 8,000 Lyme patients in my 25-year career, and I've written maybe 10 prescriptions for antibiotics. So the beauty of herbs is that because they are chemically complex They don't just have one ingredient like a lot of antibiotics that really kind of only target on killing the bug. With herbs, they might have constituents that kill certain microbes, but they have components that are anti-inflammatory. They promote better circulation. They can help support your immune system. So it really gives us the opportunity to mix and match for each individual person what they need specifically to address their collection of symptoms. So I like the fact that we get this broad effect, but we don't get the risk of really damaging the gut microbiome. These are plants. Our bodies know how to assimilate plants quite well. So we rarely get complaints of die off or certainly killing your gut microbiome. We know that a lot of antibiotics can damage your mitochondria. Lyme disease itself can damage your mitochondria, and that's literally part of the cell that creates energy and facilitates cell repair. So we don't have to run the risk of harming the mitochondria with plants. And again, they're just, I think for most people, they are a safer, effective, cost-effective option over antibiotics.
And nutritional supplements?
Yeah, I mean, we use a lot of nutritional supplements. Again, I'm not in the camp of sending people out the door with 50 supplements. I think again, we want to encourage people to eat good food. We try and want to do as much of this through diet and just general nutrition. But there are certain things that a nutritional supplement can help where it may not be possible to get the amount that we want through diet alone. We're using it almost as a drug at that point. But some nutritional supplements can help improve mitochondrial function. We use things like coenzyme Q10, acetyl L-carnitine, vitamin B6, magnesium. We can use these nutrients for very specific things where we feel either maybe they're not getting enough in their diet, or maybe we want to give doses higher than you would get through the diet that have this physiological effect that can start to get people functioning better.
Okay, so Matthew, um, so basically can you discuss your patient experience as you go down this road? Like how many people are you seeing and using this whole holistic modality with connection and all the other pillars that you discuss? And how has that changed their outcomes? Have you seen significant changes in their outcomes?
Yeah, so I see patients or clients for between an hour to an hour and a half, if it's a couple or families. So I have a small panel, right? There's only so many of those I can do in a day, but seeing really dramatic changes as we bring all of this together for them. And what's really exciting is that they get hope again, right? They learn over time. There's a lot of education around how this affects their bodies, why we're doing it. At first, they're like, I'll just say, hey, I need you to trust me on this. But over time, they start to understand through education why this works. And it's really rewarding, right? Because like we talked about earlier, you set the stage for the body to do the healing. But a lot of people aren't healing, not because there's something wrong with their body, because there's a piece missing in sort of that stage setting, right? So, sort of like what people think, oh, we heal broken bones. We line the bones up and then the body heals them. So we have to align a bunch of things in their lives, and it takes a little time to do that, but then their bodies start to heal. So, whether it's, like I said, it can be chronic pain, all different types of chronic pain. It can be all sorts of gastrointestinal issues, fatigue, headaches. It can be all the different levels, the continuum of anxiety and panic and stress. And then there's also the piece, I'm one of the few medical doctors that's also a certified nonviolent communication trainer. That was a 4-year training process for me, actually harder than medical school if I had to.
What was the training called?
It was nonviolent communication as a CNBC certified trainer of nonviolent communication, which teaches people how to communicate and connect, and super powerful. And anyway, this is just another piece of the puzzle, that when the way people are interacting and suppressing and sort of this state of artificial harmony that a lot of people are living in their lives, whether it's work or at home, it contributes to that sense of sort of being in that survival mode, that threat physiology that's going to run the systems amok, right? It's going to cause all sorts of problems. So again, there's different tools that we bring in that help to lead to these outcomes. Does that make sense?
It does. And do you think that it is this, like, with having connection and compassion and empathy, all those things are de-stressors, right? It is, based on what you're seeing, is the pathophysiology related to all the stress hormones that we experience when we're isolated and alone? We don't have support. We're trying to navigate a world, and we're pretending to be something in order to keep that
Right.
harmony. Is that? But is
It's
that what's making it sick?
it's
Like,
no,
how is it
no,
physiological?
I don't want to reduce it to something like a stress hormone. There's so many different mechanisms that are going on at the mitochondrial level, at the cytokine level, at the hormone level, at the blood flow level, at the autonomic nervous system level. It's this symphony that's sort of interpreting what's going on inside of you as well as what's going on around you, and it's trying to prepare you to do what you need to do, which is either fight threat or to sort of grow and restore and reproduce. And depending on what's going on, it's going to shift physiology. And everything we do affects that, right? So the food we put in our mouths is going to affect how the body responds, right? So if you put processed foods, they're going to affect the mitochondria. They're going to affect the pro-inflammatory cytokines. They're going to affect even blood, right? So all of that is happening. And what we have to do, it's almost, we're learning bits and pieces of it. But if anybody says, I know the answer, here's what's going on, I think at that point, red flags go up. What we do know is that if you put these pieces, what we talked about with the 9 pillars, but if you put those pieces into place, you're going to increase the chances that your body, like those bones, are going to align and the healing is going to be able to happen. But if I said, hey, I know exactly what's going on and I know exactly why you're healing and it's this hormone or it's that cytokine, that's a problem. And that's what we're trying to do with conventional medicine is say, oh, if you give them this pill, it's going to block this reaction and that's going to fix all their problems. And I'm not saying it doesn't help in some cases when you weigh the risks and benefits, but there's no medication that's going to fix all of people's problems. And that's what they know intuitively. And even when they're on these bag of pills or doing the next fad diet, they still feel awful. That's why they're coming and looking for more help. If everything was great, they would stop going, looking for more advice and more help.
It actually sounds very similar to what T. Colin Campbell often talks about with regard to not reducing things down to their constituent parts and recognizing that there is this dynamic within the whole that can't be broken down and understood by looking at its parts.
Exactly. I love Colin's approach. Sometimes what I even the way we approach diet, it's almost too simple for people. Like I like to, it's hard enough to try and do all the stuff that we tell you to, right? So where I can make it simple, I want to make it simple, right? So people, oh, it's got to be this food is okay and that food, if you eat a green apple, that's healthy, but a red apple is bad, and like it can't be that. We got to simplify it. People ask me, for example, we were talking about salt earlier. They're like, "What's the healthiest salt?" I said, the what's the most expensive salt? I said that's the healthiest because you're going to use the least amount of it, right? Like to me, that's how simple it is, right? So, but is salt good or bad? Well, if a little bit of salt's going to get you to eat these foods, then a little bit of salt's probably good for you. But if you don't need it, then don't use it, right? That's too simple for people. Mm-hmm. Right. So that's the challenge. Hey, what's hard is the nonviolent communication, right? And how to all of a sudden think and talk differently to people and see the world differently. So if you're going to make something hard, that's hard. So dive into that. And, the stuff where it can be easy and simple, accept that it's easy and simple. Right. And then the other thing I try to do is remove the noise. There's so much noise that's confusing the heck out of people. Right. We got to try and decrease the noise and help them focus and then jump on board.
Thank you. I think it looks like Jennifer may have a new salt recommendation when people ask her about salt.
Yeah, I love that. That's awesome. Yeah,
So,
and I mean, I think, I don't know. I would love to know with everything that you're talking about, like with even someone that's further along in chronic disease, because when you're talking, I'm thinking about, almost moving down tertiary prevention where, somebody's already on dialysis, and then, their mindset, that it's so hard and working with their mindset because they get very depressed. But
Right.
I'll tell you one thing that really is, we push home therapies for someone to do dialysis at home, which if I was on dialysis, I would do dialysis at home. But sometimes people don't want to do that. And they'll tell you this, they'll say, but when I go to dialysis, I see other people like me. And they will talk in the lobby, and they will, because, in a dialysis center, it's like chair, 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 chair. It's open, they're seeing each other, and it becomes family to them. And
Exactly.
so, in a sense, sometimes people, even though science tells us that they're going to do better doing a home therapy, but they're mentally better going into the center sometimes. Not always,
Right.
but
Right. But that connection, they naturally are drawn to that connection. Right. And that
Mhm.
their body, and that's what I'm saying. There's a lot of wisdom in our bodies. And if we stop and listen to it, right, all of a sudden it can take us in some really healing directions. And I think what you
Yes.
pointed out is really powerful.
Mhm.
Now, and
Well,
I tell people, I also, when people get depressed and say, "Oh my God, I have end stage cancer," I think I empathize with everybody, and at the same time, I tell everybody, I don't care what you look like. I tell everybody you have cancer. Everybody's got kidney disease. Everybody's got heart disease, right? Everybody's got some insulin resistance. But where are you on the continuum? Right now, my body is trying to fight all sorts of mutations, right? That are going on every day. It's trying, the immune system, our natural cancer fighters, trying to help. There's the environmental toxic burden that we're trying to navigate, and it's trying to keep me sort of above water. Same thing, I got some kidney damage just from the years of being alive. So, I got some heart disease. We know that kids, very young have fatty streaks on their blood vessels, right? So think of it as we all have all these diseases and our body is trying to heal them all. So why not do the diet, the cardioprotective diet or the renal protective diet, which happens to be a healthy, whole foods, plant-based diet, right? So that diet is, to me, that's the answer. To go on if you have cancer, they tell you, mainstream associations will say eat more fruits, vegetables, and whole grains. That's a great diet for people that have had cancer. That's what they say. Well, great, of course. So eat that diet before you have cancer. The same diet that helps you after you get diagnosed is the diet that I would be on before. The same thing that diet helps you after you get kidney disease. Why not try that before you get diagnosed? Because when you get kidney disease is what you really mean is when you're diagnosed, when you got bad enough that you're diagnosed. When you got diabetes is when your insulin resistance got bad enough and you spilled enough blood sugar, glucose in your blood that we could pick it up with our tests. When do you have cancer? On average, it's 10 years old before we can pick it up and it's 1 centimeter big on the scans. But it's been growing for 10 years. So that's not when you had cancer. You actually had cancer on average 10 years before we could diagnose it. So start treating yourself like you have all these diseases, not to depress you, but to give you a little fire under your butt to start making these changes. I don't know if that resonates.
Really,
I
No,
that
personally resonate with it.
resonates. That's,
it,
yeah, I love that.
it totally resonates. And to kind of go further down that road, the idea that we give our children all these foods and we say, oh, they can eat it because they're young. And basically we're setting them up for the diseases, which become the reason why you can't eat it when you're older and you feel so terrible.
Mhm.
And it's like, well, it's really it's crazy. So I was going to ask both Darin and Jennifer this question, which is, have you noticed any correlation between someone's their support, their if someone has nothing in their life? I'm sure both of you guys have encountered somebody as a patient that is isolated, is alone, that does not have a support system, versus somebody whose family comes with them and they have tons of support, they have a social life. And have you noticed in your patient population any sort of difference that ever stood out to you as to how those social aspects, those more human outside of the body aspects, affect the success of any particular treatments?
You want to go first or you want me to?
No, please go ahead, Jennifer.
Okay. So yes, I mean, for sure, in again, in the whole spectrum. So one thing that's really interesting with nutrition is that if the family member will join, say a spouse, if the spouse will join the spouse in eating the healthier plant-based diet, they're so much more effective and they do so much better. I mean, it is just a big deal how much better. And if you think about, I always tell my children, the 5 people you're around, that's who you become. So pick your friends wisely. And the same is true with your health. The 5 people you're around is who you become. And so and I know that it's harder, I think, for someone like me. We were, Darin and I were talking about this before. I'm from Mississippi, which is the most unhealthy state in the nation. So, and I don't have what they have out in California. We got to improvise down here. We got to, do things at home, because you're not going to get it if you go out, and people around you aren't going to eat like you. So when I'm working with people, I say, you are not alone. There are people like you. They may not be, if it's say I'm working with someone in the South, they may not be right here, but they're there. And so even just having a peer or someone with you, there's peer counselors for people with kidney disease, because a peer understands where you are. So I definitely see that. And then I think I have a man in mind he was on dialysis and he was isolated. And he said to me, the only reason I am still sitting here is I want to see my daughter graduate high school, and then I'm done. I don't care. Like, he didn't want to talk to me. He was like, I'm not going to change anything about my life. I'm just hanging on, because he didn't have anything to live for. So helping people find connection. And I don't know, Matthew, if this is along the lines of what you do, but I will tell like people, when you're out exercising, I want you to smile, and I want you to just say out loud, I am thankful. Say something you're thankful for that has to do with exercise. I am thankful I have legs. There's someone paralyzed right now that cannot walk, but I can, and I'm thankful. And so I tell them, I am thankful that I get to eat these healthy foods. There are people who live in food deserts who the only place they can buy food is at the local gas station, but I can go to the grocery store and buy food. So I'm thankful for that. So I tell them to say there's something they're thankful for, specific, not just like, I'm thankful for healthy food. It has to be specific, because I think that changes the way that they look at what they're doing. Having support changes the way that they look at what they're doing. And then having 5 people around you that are healthy. If you can, if you live in the South, call me. I'll support you, but because there's not a lot of us down here, we're kind of alone. But yeah, I think it's a huge deal.
Yeah, I would agree. I mean, in my patient population, who are mostly chronically ill people, that sense of isolation is a very real problem. And I think so many people feel like they're the only ones dealing with whatever's going on. And at some point they feel like they're burdening their friends and their family and, talking about the illness. And so they don't want to talk about it. They don't want it. And depending again, where you are in the world, if you don't have that group of family or friends, and the gaslighting problem is a very real problem from even close people, that they don't really believe that you're sick. You look fine. Having an invisible illness is a kind of a terrible place to be, because on the outside, people don't see anything wrong. There's no tumor growing out of your head. So they can't quite understand why you can't do the things that they do and why you can't eat the things that they eat. And as the patient, they feel bad about that. I mean, I'm just thinking about one patient I've been working with who's in Europe. She's completely cut off from her family for various, previous, issues from her childhood. She lives with a partner who doesn't really believe she's sick and thinks she's crazy. And she can't get any help from where she is from the medical community. And she feels completely alone. And, the sad part about that is out of that comes desperation. And then you start clinging to people who are often not the best source. And in the effort to want to find community, there's that you reach out to the wrong people who often make the situation worse. I mean, I'll speak about the Lyme community because I work so much. And I realize, there's a lot of like Facebook groups and these social media groups with Lyme patients. And I get it, that sense of wanting to connect. But the vitriol and the nastiness that comes from other Lyme patients against you. I had a patient who recovered from Lyme, went on to a Facebook page just to kind of give people hope, like, hey, I spent a year or two dealing with my health. I did this, and I feel so much better. And she got more nasty comments than comments of, hey, that's great. I'm so proud of you. That's wonderful. It's like, well, aren't you lucky? Well, gosh, you must have a lot of money. I mean, it was just that kind of stuff. So, it's complicated, and how, we as practitioners can help our patients find that sense of community. I personally find it very challenging, but I think it's essential, because definitely my patients who are more isolated, they are not doing as well. They're struggling mentally, physically, emotionally, spiritually, and it's really challenging.
So Matthew, you spoke about studying nonviolent communication, and it was even harder, you said, than medical school. What would you suggest in these groups? And, even, in the plant-based world, I've constantly watched organizations implode because of inner organizational factions or dynamics, and they destroy each other. This infighting, right? What is that education that into nonviolent communication suggest in creating support networks within, I mean, like a Lyme group? I mean, it's called a support group. I think the very foundational principle should be supporting one another, right? And yet they constantly fail. And any organization that is, mission oriented is constantly struggling with this infighting. How do we avoid that based on the communication skills that you learned?
Right. Well, how you show up has ripple effects. So how you respond, how you go through, even how you think about the person that just said what they did, right, will affect the outcome. And I think, hurt people, right? Have you heard of that saying? So when somebody is lashing out is when they're usually in the most pain, but they talk in a way and think in a way that makes them least likely to get the empathy that would heal their pain. Right? So the question is, can we translate whatever messages are sent towards us and start to shift that? And that's a practice. It's not you're either born with that skill or not. You can actually learn that skill. I know, because I did. Right. So people in general, when they show up in a way that doesn't seem to be like they're caring about your needs as much as they're caring about their needs, right? Or they lose connection with the humanity behind the screen, right, that they're communicating to. That's an education problem. That's a socialization problem. So there's nothing wrong with that person, but they've been educated in a way or socialized in a way where they are prioritizing their needs or disconnected from the impact of their actions on other people. So once you start to shift your framework, then you can start to respond differently to people. And I think that's where your power is. Rather than trying to control how someone else reacts, focus on controlling how you react to however they react. Right? And if we can start focusing on that, that's when the change starts to happen. And also catching ourselves, right? So if I am saying on one hand, boy, this world is so polarized, but then on the other hand, I'm hating Trump or Biden, right? Pick your person, right? I'm contributing to the problem versus trying to heal the problem. So I have to also hold myself accountable to how I show up. And I would say sometimes I'm able to do that really well. Other times I'm not. And then I go back and I repair.